Ever wondered why medical professionals insist on cleaning a wound before obtaining a culture and sensitivity? Let's explore the reasons. Cleaning a wound is a crucial first step in wound management. It helps prevent contamination from foreign particles and reduces the bacterial load, which can lead to infection if left unattended. It's like clearing the battlefield before the actual fight, preparing the ground for the body's healing process to take place smoothly. By cleaning, we also remove debris, dead tissue, and any other foreign materials that could interfere with the healing process. This step is essential in promoting healthy tissue repair and regeneration. Moreover, cleaning a wound before obtaining a culture and sensitivity increases the accuracy of the results. It helps to ensure that the bacteria being cultured are those causing the infection, not just superficial bacteria from the skin's surface or the environment. So you see, cleaning a wound is not just about hygiene, it's about getting accurate results. Now that we know why it's essential to clean a wound, it's time to learn how to do it properly. The process begins with the use of gloves and sterile equipment. This is crucial in preventing the introduction of new bacteria into the wound. Next, we use sterile saline to cleanse the wound. It's a harmless solution that does not irritate the wound but is effective in flushing out debris and bacteria. The saline should be gently applied to the wound using an 18-gauge, 30 to 35 cc syringe or irrigation bottle for control and precision. Remember, when cleaning a wound, the goal is to be thorough but gentle. The last thing you want to do is cause further damage. Once the wound is clean, it's time to obtain a culture. This step is crucial in identifying the bacteria causing the infection. So let's get into it. First, you'll need a sterile swab. It's important that the swab is sterile to avoid introducing new bacteria into the wound or the sample. Now, for the technique, data has shown the Levine technique to be the superior method. Start by selecting a 1 cm squared area of clean, viable tissue in the wound bed. Rotate the swab for 5 seconds while applying enough pressure to express fluid from the wound surface. As you swab, be careful to avoid contact with the skin surrounding the wound. The skin is home to its own set of bacteria, known as the skin flora, which are not usually harmful. However, if they get into the culture, they could skew the results and lead to a misdiagnosis. Proper swabbing technique is critical to ensure the culture represents the bacteria within the wound, not those on the surrounding skin. So always remember, it's all in the swabbing. Let's review what we've learned today. Cleaning a wound before obtaining a culture and sensitivity is a critical step and best practice. It's about ensuring the accuracy of the results. When you clean a wound, you're eliminating potential contaminants that could skew the culture and sensitivity results. This helps to identify the true pathogens causing the infection, allowing for more effective treatment. We've gone over the steps to properly clean a wound. Start with gentle irrigation. And finally, after the wound is clean, that's when we obtain the culture. So remember, next time you're tasked with obtaining a culture, always clean the wound first. It's not just about hygiene, but accuracy too.